Today's topic is protecting public health from false climate solutions with Kathleen Schuler, MPH. Fossil fuel companies are promoting an array of technological and market-based solutions to the climate crisis. We can evaluate these solutions by asking who benefits? What is the amount of greenhouse gases reduced? Are there better alternatives? Is it part of our zero emissions future? And are there external harms to air, water, land, and human health? While there are many false solutions being proposed, this presentation will specifically cover low carbon fuel standards, carbon capture and storage, bioenergy, waste incineration, and mining as false climate solutions for Minnesota. Kathleen Schuler, MPH, Master of Public Health, is the State Policy Director and Board Member of Health Professionals for a Healthy Climate, a network of hundreds of doctors, nurses, and other health professionals across the state of Minnesota working to protect human health by promoting climate health. Kathleen previously served as co-director of Healthy Legacy, a Minnesota coalition and campaign to advance public policies to protect public health from toxic chemical exposures. Kathleen has a Master of Public Health degree from the University of Minnesota and is a former Bush Leadership Fellow in Environmental Health. Kathleen, the floor is yours.
Thank you for inviting me to talk to you today. I'm going to share my screen. I have a lot of slides, so bear with me. Well, welcome this morning. As Ellen said, I'm going to talk about public health and false climate solutions. Health Professionals for a Healthy Climate, we are a nonprofit organization based here in Minnesota, and we inspire and activate health professionals to address climate change through interprofessional education, clinical practice, and public advocacy. We promote a climate equity policy agenda. In order to solve the climate crisis, we need to center climate equity so that we can transition to a carbon-free economy and prioritize investment in BIPOC communities to create climate resilience and healthy lives and communities. To that end, we published Climate Justice and Public Health in Minnesota, and that report is available on our website. We would like to undo some of the systemic racism that created these inequities, but also we need to look forward and make sure that our policies incorporate equity going into the future. As part of our work, we believe climate change is a health emergency. We developed a declaration on climate change and health based on one that was developed by National American Lung Association a few years ago. We adapted it to Minnesota, and we invited health organizations based in Minnesota to sign on to that. And we had 14 health organizations representing physicians, family practice, pediatricians, nurses, public health psychologists, who agree with us that we really need action to reduce the impacts of climate change. We need to reduce carbon emissions so that we can protect health and save lives. We are a science-based organization, so we look to the Intergovernmental Panel on Climate Change, the IPCC, who says that the continued installation of unabated fossil fuel infrastructure will lock in greenhouse gas emissions. We've already locked in some emissions, and we like to keep our global warming at 2 degrees centigrade, hopefully less. We are really concerned because fossil fuel pollution causes air pollution that is responsible for 350,000 premature deaths in the United States every year. And it's not only premature deaths, there are also hospitalizations, ER visits, instances of dementia, and crop losses. All of these things are the result of climate change. I don't know if anybody's seen this publication, Hoodwinked in the Outhouse. I keep wanting to say outhouse. Has anyone seen this? This is a publication by 18 groups, including Indigenous Environmental Network, who's based here in Minnesota, and the Climate Justice Alliance. And they list a number of false climate solutions. I'm only going to cover a few of them today, the issues that we work on as health professionals. One of the things that I thought was really helpful at the end of this publication, they talk about real solutions, and they say that real solutions must be guided by environmental justice, just transition, and energy democracy, must be guided by Indigenous traditional knowledge and place-based experience and public interest science. It must address both ecological and social harm and replace economies of greed with economies that serve ecological and human need. Also advance democracy and self-determination and center the needs and leadership of those who are most harmed. So we agree with that, and Health Professionals for Healthy Climate shares those values. And we are part of the Rise and Repair Coalition, which is a diverse alliance of people and organization advancing Indigenous rights and climate justice in Minnesota. And tomorrow, we were just talking about a hearing that's taking place on the Rights of Menomin bill, which I think we can share information on where that is if you wanted to tune into that. So false climate solutions, according to the new energy economy, are technological or market-based schemes promoted by fossil fuel companies and their political allies to give the appearance of meaningful climate action while actually functioning to delay effective policies that might challenge their power, control, or profits. So we developed a framework for evaluating climate solutions, and this was developed in conjunction with our partner groups at Sierra Club and CURE. And also we worked with the House Climate Action Caucus to develop these questions. So the first question is, what is the amount of greenhouse gases actually reduced? Is this part of our zero emissions future? In Minnesota, we have goals for 100% clean energy by 2040 and 100% carbon-free economy by 2050. So if something is generating carbon and is fossil fuel based, it should not be part of our future. Are there better alternatives that are cheaper and faster to get to our carbon-free goals? What are the impacts on air, water, land, and health? If something looks like a solution, but it's really going to harm our environment and human health, then is it really a solution? And also, who benefits? If fossil fuel companies are benefit, you can bet that it's probably not going to be helpful in terms of actually reducing our climate impacts. So what I'm going to talk about today are low carbon fuel standards, carbon capture and storage, and biomass burning and waste incineration as climate solutions, which I believe are false solutions. So the first topic is low carbon fuel standard. Has anybody heard about the Minnesota low carbon fuel standard? Okay, so this is something that is not on people's radar. In Minnesota, we introduced a low carbon fuel standard in 2024. And a low carbon fuel standard is a market-based policy, and it's designed to incentivize the use of transportation fuels with lower carbon intensity. So in Minnesota, transportation is the biggest source of climate emissions of any sector in our economy. And the theory is if we can lower the carbon intensity of fuels, then that is a solution to lead us to our carbon-free future. So the eligible fuels would be corn ethanol, cooking oil, biodiesel, gasoline, electricity, and biogas. What happens is the regulatory agency sets an annual CI, which is carbon intensity level that all fuels must meet, and then it goes down over time. Because we don't have a federal program, these are state-based programs. So the state regulatory agency sets this. They must measure the the fuel producers must measure the life cycle carbon intensity using the Argonne Laboratories GREET model. And this is a model used by all 3 states that have programs. So cleaner fuels such as electricity earn credits, while higher carbon intensity fuels such as gasoline and diesel generate deficits. Credits can be sold to offset deficits and provide revenue to fund greenhouse gas reduction projects such as EV charging infrastructure. So in California, they have provided millions of dollars for EV chargers. The 3 states that have programs are California, Oregon, and Washington. So California, as the program with the longest standing experience, it's really informative to look at what actually has happened in California. 80% of the low carbon fuel standard credits were generated by biogas, which was created by factory farms, and they have an increase in CAFOs, or confined animal feeding operations, in California due to this policy, and biodiesel that creates air pollution. What happens is this is a very complicated program, and so it's very easy to game, and it has been gamed by the fossil fuel companies. What has happened with the biodiesel is the demand for crop-based fuels, so it would be soy, canola, palm oil, has become unsustainable, which risks deforestation and competition for food because you're using more land to grow those crops, which creates more greenhouse gas emissions. The credit prices are dropping as a result, meaning that there's less investment in the EV charging infrastructure and the effective solutions for greenhouse gas emissions. These concerns were reflected in Stanford University paper outlining some of the problems, and also 37 California environmental justice, health, and public interest groups sent a letter to Gavin Newsom in 2023 outlining their concerns. And you can see with this graphic that biodiesel on average has 1.8 times the greenhouse gas emissions of fossil diesel. So it's not really a solution. Now, we know that we're not California, we're a Midwest corn growing state. So this program will affect Minnesota differently than it would California. But I think the point is, this is a program that can be gamed very easily. In Minnesota, in order to get public input, there was a Minnesota Clean Transportation Work Group that was convened, and I had the opportunity to participate in that, as have many both industry representatives, environmental groups, including Sierra Club and CURE, who I've worked closely with on questioning this policy. They finally issued a report. What happened during the process is they didn't listen to dissenting voices. They didn't deal with the reduction in air, with the effects on air and water pollution and human health. And so in the final report, they say that this policy was going to reduce air and water pollution and improve soil and water health in Minnesota, when it is exactly the opposite. And this was something that was not discussed during the process and was glossed over. So we were very concerned with that. So we pulled together our own report, which is on our HPHC website. A Midwestern low carbon fuel standard is not a climate solution. We collaborated also with COPAL, CURE, Sierra Club, and HPHC. And I'll explain why we think this isn't a good idea. Ethanol burns clean, but creates more emissions than gasoline. Low carbon mandate could increase carbon emissions in Minnesota. This is an op-ed by Dr. Jason Hill at the University of Minnesota. He has long questioned this policy and recommends that we go straight to investing in electrification instead of fooling around with a policy that's going to take years to implement and has questionable results. This is a paper that we looked at by Tyler Lark and colleagues, which concluded that corn ethanol could be 25% 24% more carbon intensive than gasoline. And with this particular study, they looked at the renewable energy standard, which mandates that we mix ethanol in with our gasoline at a 10% level. And they found that not only could it increase carbon due to land use changes. So what happened is the price of corn went up as the result of the program. And so more land was devoted to corn acreage, which resulted in more greenhouse gas emissions because you're plowing and growing and you have all these chemical inputs for corn growing. It also increased fertilizer use and also the water quality problems that go along with that. And also nitrogen in fertilizer was increased. So the increase in nitrate leaching and also phosphorus runoff and erosion. And participation in the conservation improvement program decreased as well, which decreases the natural carbon sequestration, which happened with this program. So some of the harms from ethanol production and corn growing are corn is a very intensive, water-intensive crop. Pesticides and fertilizers are critical to the growing of corn in the Midwest. So we have the nitrogen and phosphorus pollutants and the human health impacts, including blood disorders, cancers, and blue baby syndrome from nitrites in drinking water for very young infants who are drinking formula. The environmental impacts, including algal blooms. And also, I mentioned the land conversion, which reduces natural carbon sequestration. The more acreage devoted to corn, the less we are actually naturally sequestering carbon. And also the opportunity cost of not investing in agriculture. And the model that's used to measure carbon intensity, the GREET model, does not include any of these ecosystem harms. The actual greenhouse gas emissions are very low and don't increase over time, whereas fuel economy standards, both in 2030 and 2050, are significantly higher. Likewise, electric vehicle sales and mode shifting, which is reducing vehicle miles traveled. So the more we can not drive our cars, the more greenhouse gases we can reduce. So it seems to me that it's contrary to our goals to implement a low carbon fuel standard when we can look at some of these other strategies, which are much more effective. So in summary, a low carbon fuel standard is a false climate solution. Ethanol does not have a lower carbon intensity than gasoline. It builds on the current fossil fuel infrastructure and extends the life of liquid fuels. It creates air, water pollution, soil degradation, and health impacts from corn growing. And it depends on CO2 pipelines to reduce carbon intensity. So the hope is that, and I'll explain about the carbon pipelines, you can reduce your carbon intensity by capturing some of the CO2 in a carbon capture technology. And it can reduce the carbon intensity something like 20%. So I think the ethanol producers in this low carbon fuel standard are going to depend on carbon capture as part of their carbon reduction strategy. This is a policy supported by the fossil fuel industry, and straight up going to electrification of vehicles is a much better, cheaper, and more effective alternative. So the second topic I wanted to cover that's closely related is carbon capture, utilization, and storage. And some people refer to it as CCS, carbon capture and storage. But it's really the utilization part that's concerning because the utilization involves capturing fossil fuels. This is a picture of the Summit Carbon Solutions proposed pipeline, which has part of its mapping is in the state of Minnesota. This is a graphic that I got from Sarah Wolf, and she has been working with Cure on this issue. So fossil fuels quiet business model. Number one, capture the CO2 from an ethanol plant. Number two, put it in a pipeline to carry it to another state or another location where it's used in enhanced oil recovery. So there's very hard to reach oil reserves that you can reach by injecting CO2 into the ground. And this is why the fossil fuel companies love this program. And we also have policies, public policies that support this business model. In the Inflation Reduction Act, there are 45Q tax credits that allow a tax credit for building a pipeline, a CO2 pipeline. And then there are state low carbon fuel standards that encourage the building of these pipelines. And for the tax credit, they get $84 a ton if they geologically sequester the CO2, and $60 a ton if they use it in EOR, or enhanced oil recovery. So why does Minnesota need to build a pipeline? And this is from Summit Carbon Solutions application. Capturing the plant's CO2 reduces the environmental impact of the plant's ethanol product and improves the plant's ability to compete in low carbon fuel standard markets. So clearly, this is part of the plan. And from their final environmental impact statement, they say that this pipeline will enhance its marketability in low carbon fuel standard markets. So clearly, the two policies are closely related. Why are we concerned about carbon capture and storage? So first of all, what happens is you capture the CO2 at a refinery, a power plant, or ethanol plant, and you transport it through a pipeline to another state. 90% of the CO2 is used by oil and gas companies for enhanced oil recovery. The current experience is that this technology is very expensive, very water and energy intensive, and underperforms in terms of actual sequestering of CO2. And I'll show you an example of that. It creates air and water pollution and land disturbance. It diverts necessary funds from effective climate and pollution solutions and squanders precious water and energy resources. And there are also health and safety issues, which we're very concerned about as health professionals. This is an example of a CCUS program that's been active for 35 years in Chute Creek. That is in the state of Wyoming, and it's operated by ExxonMobil. And this Chute Creek site is capturing it from a emissions vented from a gas site. So this isn't an ethanol plant. But with the experience, 50% of the CO2 was vented and 47% was sold for enhanced oil recovery. Only 3% of the CO2 was actually sequestered. And it's a very costly program. So this is why we're not recommending this for Minnesota. We're concerned about the health risks of CO2 pipelines. Liquid CO2 is transported in a pressurized state, so it's highly explosive. It's corrosive, so it can corrode the pipe and increase the risk of leaks. It is odorless and colorless, and concentrated CO2 is an asphyxiant. It's also a recognized toxicant by OSHA and other agencies. Gaseous CO2 is 1.4 times heavier than air, and liquid CO2 is 10% heavier than water. So it settles on the ground, it flows downhill, and it displaces ambient air. A pipeline explosion occurred in Satartia, Mississippi in February 2022, and there's a couple of articles in Huffington Post. 200 people were evacuated, some of whom have long-term health impacts. Cars just shut off since they need oxygen to burn fuel. Drivers scrambled out of their paralyzed vehicles, but were so disoriented that they just wandered around in the dark. So this happened, and this is a risk to happen elsewhere. Also, Satartia is a BIPOC community, so this is really an environmental justice issue. These pipelines are located in rural communities or low-income areas. We do not have regulations on CO2 pipelines. The Pipeline and Hazardous Materials Safety Administration, or PHMSA, was drafting regulations and after this leak, and they initiated the rulemaking to update the standards to require training of personnel of local police and fire departments, requiring communication, requiring that they have maintenance requirements. And we have 5,000 miles of pipelines currently in the United States that are not regulated. So this rulemaking was getting ready to be published for public comment when the Trump administration has withdrawn the draft rules through an executive order. I don't know if they're going to be revived. I hope so. So at the same time, we do not have safety regulations. We still have the 45Q tax credit, which is going to be an incentive to build more pipelines. So in summary, CO2 pipelines are not a climate solution. They put communities at risk for life-threatening exposures and incapacitate emergency response systems in the case of a leak. They are not cost-effective as a global warming reduction strategy, and they impact our health. They cause irreparable harm to land and water, and fossil fuel companies profit. And a lot of the work that's being done on pipelines in Minnesota is through CURE, and I think you've probably had a presentation by Hudson Kingston previously. So CURE is doing great work on this. Another pipeline or another CO2 capture project is the Rio Tinto carbon capture, and it's used to create carbonic acid, which is injected into basalt rock where it forms solid carbonate minerals. And the concerns outlined by Tamarack Water Alliance, and they can speak for themselves, but I took this information from your website. It requires porous basalt rock to allow absorption, and Minnesota's rock is about 1 billion years old, so it's less porous. Therefore, this could be less feasible in Minnesota. Pumping under pressure can cause earthquakes, and if carbonic acid leaks upward, it could affect local aquifers, potentially acidifying the water table. It also uses a lot of water from local aquifers, potentially lowering surface water levels. And about 1,700 acres of 10-year-old forest will capture as much CO2 as this project. So really, if we look at natural carbon sequestration, even the IPCC says it's a much more effective strategy for sequestering carbon than carbon pipelines. And the final issue I wanted to mention as a false climate solution is bioenergy and waste incineration. To provide context, you're probably aware that Minnesota passed 100% carbon-free law in 2023. It requires that all of our energy be carbon-free by 2040. Hopefully you're familiar with that, and we celebrated that along with other groups that we worked with. And the statute that is behind this program defines carbon-free as a technology that generates electricity without emitting carbon dioxide. It's very clearly defined in statute. So this program has to be carried out through rulemaking, and the Public Utilities Commission has a current docket on this. However, what's happening is through comments by industry and even the Minnesota Pollution Control Agency, they're trying to stretch the definition of carbon-free to include biomass burning as carbon-free, or at least for partial credit. We've commented that this should not be allowed because of the health risks. Our comment said that wind, solar, energy storage, geothermal are clearly carbon-free. Nuclear has issues. It's technically carbon-free, but it has other issues, as you're aware of. And then hydrogen can only be considered carbon-free if there's a life cycle analysis and that it's generated through renewable energy. So the reason I'm mentioning them is because of a lot of the public comments saying that burning biomass and waste incineration should get partial credit. We wanted to push back, and we commented to the PUC about the health impacts of co-pollutants from burning biomass and waste incineration. So burning anything creates carbon. Greenhouse gas emissions are comparable to coal plants. There's less energy produced per ton of carbon. Trash incineration emits 2.5 times the greenhouse gases per unit of electricity than coal-fired plant, and 3.8 times the greenhouse gases as the grid average. It also creates co-pollutants and environmental injustices. So I won't read all of those co-pollutants, but nitrous oxide, sulfur dioxide, hazardous air pollutants, particulate matter. It increases the risk for cardiovascular and respiratory diseases, stroke, asthma, autism spectrum disorder, premature death. And waste incinerators also emit those toxins, in addition, dioxins and furans, PFAS, and heavy metals like mercury. That increases the risk for cancer, respiratory and heart diseases, reproductive and developmental problems. And most of the incinerators are located in BIPOC communities. The urban incinerators, such as the Herc incinerator, is located in North Minneapolis. We also have premature deaths from biomass burning, and there's a couple studies in the European Union. One found an estimated 40,000 excess deaths attributable to use of biomass energy. Another study two studies in Denmark and Sweden found that air pollution from wood burning in rural areas was comparable to levels in urban areas with high traffic. So, just think about that possibility. And then finally, Bionacor et al. Did a study in the US of the premature deaths as a result of wood and biomass burning, and they found 18,000 excess deaths. So air pollution causes excess mortality, and this is one source of energy that exacerbates that. Also, the environmental justice impacts of biomass burning are significant. As I mentioned, 80% of waste incinerators are sited in BIPOC or environmental justice communities. In Minnesota, we have 7 incinerators, 6 of which are located in environmental justice communities, according to the statutory definition of environmental justice community. One of them is the Hennepin Energy Recovery Center, the Herc in Minneapolis. Another one is the Olmsted Waste to Energy Facility in Rochester. This adds to the burden of air pollution from traffic and industrial sources that these communities already experience. And the Department of Health specifically commented on Minneapolis and Rochester with the adverse health impacts from high levels of air pollution. In the zip codes surrounding the Herc incinerator in north-south Minneapolis and downtown, they have the highest asthma rates for pediatric asthma in the state. And likewise, even in urban areas in outstate Minnesota, areas such as Rochester also have health impacts from fine particles and ozone. Another concern is woody biomass production, which also involves burning biomass. They include processing plants and plants that burn biomass for energy. They expose communities to heavy-duty truck emissions, on-site wood burning for energy, and water pollution. The NAACP found that African Americans living near biomass power plants are exposed to smog, asbestos, sulfur dioxide, and other toxins which put their health at risk. And we have 4 in Minnesota: St. Paul, Virginia, Hibbing, and Duluth. What's really helpful is in Duluth, a few groups, Fresh Energy, Sierra Club, and MCA commissioned a study of the health impacts from the Hibbard Renewable Energy Center in Duluth. And they found that projected emissions for Hibbard could cause an estimate 6.4 to almost 39 deaths and $70 to $437 million in healthcare costs. Now, that has to be a range because you're estimating, but at least it quantifies the impacts of this, potential impacts of this facility. So, real climate solutions, those are some of the false climate solutions, and there are others as well. For transportation, reducing vehicle miles traveled, electrifying public transit, electrification of light, medium, and heavy-duty vehicles. And for aviation and maritime transit, we need to look at innovative ways to reduce carbon emissions because we can't easily electrify our airplanes. We need natural carbon sequestration instead of carbon pipelines through land preservation and restoration, sustainable forestry, and regenerative agriculture. For energy generation, we need renewable and carbon-free energy, such as wind, solar, geothermal, and energy storage. And I just wanted to mention one other issue that HPHC works on is cumulative impacts, and we are part of the Frontline Communities Protection Coalition. And I don't know if you're aware that in 2023, we passed the cumulative impacts bill at Minnesota Statutes 116, and it requires that the Pollution Control Agency, when there's a request for an air permit, they must evaluate cumulative impacts in environmental justice areas before they issue the air permit. And an environmental justice area is defined as an area that has 40% or more non-white population, 35% or more low-income population, and 40% or more have limited English language proficiency. And they designated the metro area, Duluth, Rochester, and optional for tribal areas. It doesn't mean that those are the only environmental justice communities. It just means those are the only ones that are specified in statute. So this applies to those areas right now. And the MPCA is going through a rulemaking process, and they will publish their draft rules in 2026. So we are following that. And if anyone would like more information and to comment when there's an opportunity to comment on these rulemaking, to make sure that we have strong rules for cumulative impacts to protect communities. So I just have some websites. If you want more information on the low carbon fuel standard, you can find our report on our website, and you can sign up to get action alerts from us. CURE is the best source for CO2 pipelines, and the PUC Summit Carbon Solutions docket. For 100% PUC docket, we can send you more information. We're also working closely with Sierra Club, CURE, and MCA and other groups. And then the Frontline Communities Protection Coalition, you're welcome to get on that list. We can also share information. And finally, the Minnesota Climate Action Framework is being reassessed and refined. And so the agencies are welcoming public input in that, and you can go to your website and comment as citizens. So that's all I have. Thank you.
Thank you, Kathleen. And let's jump right into the questions here. Doubling back to the CTS work group, Tess asks, if I recall, there was also little or no tribal consultation by the CTS work group.
Yeah, that was my assessment. There were a couple of Native people on the group, but first of all, this is a really complicated issue. And then to really get up to speed on it, people didn't have the capacity to actually do that. And there wasn't enough information in the meetings to actually adequately inform people. So I would say yes, that it was not very good tribal consultation on that policy.
This question, is corn ethanol defined as a biodiesel, which Lynn Meisner responded to by saying growing corn for ethanol also greatly increased the use of glyphosate herbicides that accumulate in the soil as well as running off into the water.
Yeah, based on what I looked at from California, I think corn is used, but it's not as used as much as canola and the palm oil and soy for biodiesel. I can verify that though.
Tom Thompson asks, when CO2 is used in enhanced production schemes, does it in turn leak back into the atmosphere?
That's a good question. I know they inject the CO2 to capture the oil, but I don't know if it stays down there. That's a really good question, though. I'll have to look that up.
Let's see, Tamarack Water Alliance asks, what can we do personally to help move this topic in the right direction?
Well, so for the low carbon fuel standard, I think our report kind of killed the bill last session, thankfully, but the bill has been reintroduced in the House. We don't think it's going to move, but I think if you want to sign up for HPHC's email list, we can let you know if there are opportunities to push back on the low carbon fuel standard. And as far as working on carbon pipelines, I would suggest that you follow CURE and get on their list for those particular policies. And also with respect to the 100% policy, again, pay attention to what's happening with the PUC. I can send some links and information about the PUC. Is that kind of complicated? It's complicated being a citizen, right? But
yeah, I think we agree with that assessment. Suzanne remarks, oh boy, I live a mile from Olmsted County burning plant. How can I monitor air quality? Does North Star Chapter Sierra Club have a position on this?
Yeah, I think Sierra Club did sign on to our letter to the PUC. So yes, they agree with us that it's concerning.
The TWA comments, we know there are citizen-based air quality monitoring programs available, and hopefully Sierra Club can get more into that, sponsor something. Lynn Meisner remarks that she's concerned that this report is not including the carbon emissions related to manufacture and disposal of electric energy infrastructure, solar panels, and many of the components of which are imported, wind turbine parts, which have notoriously short lifespan, manufacture of electric vehicles and batteries, and repair of highways as a result of using heavier EVs. Finally, please include the many health effects of herbicide used in producing feedstocks. Okay, jumping down here, clarifying that yes, this your talk was being recorded, so anybody who's dazzled by these statistics, you can revisit that. Also, there's information in the chat about connecting with health professionals for a healthy climate. And let's see, Lynn Anderson comments, I did not know about the biomass burning in Duluth. Is any agency monitoring air quality, and how do we find out about this?
Okay, good question about the air quality. I got the information from Cure, but I can try to find out who else is monitoring. I know that the MPCA does have community air monitors, so I don't know what the process is to get one, but I think you can actually get an air monitor in your community if you want it. I don't know how many they allow or what the criteria are, but I can look that up.
Tess asks, can you elaborate a bit on the financials involved in a CTS? Where does the money come from for the credits?
Yeah, it's kind of a complicated process. Um, the the fuel producers that are generating more carbon have to purchase credits, and so therefore then that funding goes into a designated fund for building electric chargers. That's the best I can describe it. It's very complicated. And how Minnesota would do it, I would assume it would be similar to California. That's how they do it in California.
Question is, are there any health professionals on the call? And if so, would you like to connect more directly? So that's health professionals for a healthy climate. Putting it out there, if there are any health professionals on this call who would like to connect, there's information in the chat about how to do that. And
Yeah.
Kathleen, you discussed a number of things to be concerned about. What would you say? How do you think we're doing overall as a state when you go through these different concerns?
Well, I think we can do well if we stick with our carbon-free plan. What happens is something like a low carbon fuel standard, which is a very complicated thing. It sounds great. Okay, we're going to reduce the carbon intensity of fuels. So this is a good idea. But if you actually look at the details of it, which most people are not going to do, which is why we wrote the report to at least highlight, and we did get media, and if you Google, you will find our report. So at least it's out there. And we wanted to just uncover the downside of some of these strategies. I also think it's really important to look at the PUC and how they're implementing the 100% clean energy policy to make sure that it is true to the statutory mandate that everything be carbon free.
Tom asks, do hospitals monitor air quality?
You mean outside?
Yeah.
I doubt it. I really don't know. Does anybody else know? Do you, Kelly or Rachel? We have some of my colleagues on the call, Ava, Kelly, and Rachel.
They can do it by choice by doing like a greenhouse gas audit and emissions rating as sort of finding a baseline for the responsibility of their own emissions, both on site and also like what vendors and employees bring. But it's optional and we encourage it, and we're ready to work with them for reductions and mitigation measures.
Yeah, individual health professionals have been really active in the shutting down the HERC incinerator and have really been important voices. The hospital systems tend to not like weigh in on policies, but individual health professionals do.
What would replace the HERC system, that's there in Minneapolis, and how close is it to getting shut down?
Well, the goal is to shut it down by 2027. It might take a little longer than that. The city of Minneapolis has a positive resolution that was unanimous by the city council to shut it down. And the mayor agreed with that. We need the Hennepin County Board of Commissioners then to set a date. The replacement would be short-term landfilling, but the goal is zero waste. It needs to be complemented with a policy to reduce waste, a high proportion of what goes into the incinerator is bio-based waste. So if we increase composting and make it more accessible to renters and other people who normally wouldn't do it, then that's gonna at least eliminate that source and then be more aggressively with zero waste policies.
Thank you.
Kathleen, thank you for your presentation.
And feel free to contact me if you have questions. It's Kathleen at hpforhc.org.